The member for Scarborough-Guildwood.
Speaker, my question is to the Premier. Speaker, people are dying from COVID-19 in Ontario, and it seems like we're breaking records in positive cases nearly every day. And with testing numbers down at an alarmingly high rate, positivity rate is at 4.5% across Ontario. In pockets of my riding of Scarborough-Guildwood, the rate is above 11%. As a result, COVID-19 is re-entering our long-term care system with devastating effects. Scarborough is facing two of the worst outbreaks at Rockcliffe Community Care, where over two-thirds of the residents have come down with COVID. 7 have died. At Kennedy Lodge Nursing Home, just around the corner from where I grew up, 30 residents have died since the second wave took hold. Many staff are also infected. Speaker, through you to the Premier,
Question.
Why has he downloaded the responsibility of fighting this pandemic to the local public health units, but in his budget he has not provided them with any new investments? Why is the Premier stiffing the public health?
Thank you. Minister of Long-Term Care.
Thank you, Speaker, and thank you to the member opposite for the question. Our government's #1 commitment is to the safety and well-being of Ontarians, and our top priority is long-term care as we fight a virus very similar to other countries that are struggling with long-term care. And our integrated approach is really designed to make sure that we assess and access the expertise of so many groups, whether it's Ontario Health, the medical officers of health, the chief medical officer of health, Toronto Public Health, the Scarborough Health Network, which is assisting with Rockcliffe Home. And the others are integrated with hospitals to provide the IPAC expertise, to provide the support. So this is an integrated process, and it's actually multi-government as well. And it's taking everybody to be responsible, to do what they can to resolve this threat that is happening around the world. We will continue to take every measure and advance long-term care. Thank you.
The supplementary question.
Thank you, Speaker. I really want this minister to hear that what you're doing in hotspots is not working because people are dying. So you have to change and you have to do more. Speaker, the second wave is taking hold across this province. It's not just in Ottawa or the GTA. Last week, Waterloo Region asked to move to a higher tier of restrictions. Kingston saw 10 new cases in one day in a region that only reports 26 active cases. Hospitals are on track to exceed their ICU thresholds for cancelling elective surgeries in a matter of weeks. The second wave could be controlled if the government was willing to reset its approach and to take decisive action. But sadly, your budget, tabled in the midst of a second wave pandemic, is a budget of prudence when Ontarians are looking for action. Speaker, through you, what will it take for this government to act? Is it more deaths in long-term care or a complete collapse of our healthcare system?
Thank you. Minister of Finance.
Mr. Speaker, again, and I know it takes the time, but to read, but almost $800 million more investment in our long-term care sector, Mr. Speaker. $270 million for public health and support for community health services. $2.5 billion more this year for hospitals. Mr. Speaker, we respect and understand what our frontline healthcare workers are going through. That's why we provided $1.1 billion of support to purchase PPE, Mr. Speaker, to make sure that that's available. Mr. Speaker, it is a severe misreading of that budget to say anything but that it is making historic investments. As we've committed to, this government will do what it takes to support Ontarians, to support our healthcare heroes, to support our long-term care sector.
Next question, the member for Mississauga East.